Hi guys, it's me, Professor D, and welcome back to my YouTube channel. This video is going to be very different from the normal videos that I release. It's going to be a short video, but on this video, I want to go over subjects and concepts I encourage you to add to your studying material before you go sit for your next generation NCLEX review, okay? These are general subjects, but everything that I mentioned that I talk about, you need to know all about it. So for example, if I say lithium, you need to know that drug class, you need to know the adverse effects, you need to know the nursing interventions, you need to know the patient teaching, you need to know everything around that medication, okay? So I'm going to be very general, but you, the student, you better know everything around what I'm talking about. And guys, I don't see NCLEX. I don't. So I don't know what is on that test. But what I do know is I have lots of students every single day that go and take their board and they're passing and they're coming back to me and they're saying, Professor D, I saw this, I saw that. And I'm starting to notice a pattern, no matter what state my students are testing in. And so I just wanted to share this information with you. It's in no particular order. All right, so let's get started. Oh, wait, no, I got to do my plug. Don't forget, if you haven't done so already, go ahead and press the like button because you're going to love this video. If you are studying for your boards, about to study for your boards, this is going to be very helpful for you. So press that thumbs up button now so you don't forget, like this video, subscribe to my channel if you haven't done so already. And let's say you're in the nursing program right now. You're not there yet, but you know someone who's studying for the next generation NCLEX. Forward this video to them, help them out. Also, don't forget, I'm now offering next generation NCLEX reviews. I'm offering one-on-one tutoring sessions, consultation sessions, all of that. You can reserve your spot right now by going to my website, nexusnursinginstitute.com. If you're a current nursing student and you are struggling, you have to do really, really well on your next exam, go check out my audio lessons. That can be found at my website, also nexusnursinginstitute.com. Okay, now we can get started. All right, so like I said, no particular order, and I just jotted this down. Cardiac cath, nursing interventions. So make sure you know all about cardiac cath, make sure you know about the nursing interventions for the patient. You know, for example, you want to keep, let's say that cardiac cath is done through the femoral approach, you want to make sure they don't cross their legs, stuff like that. Make sure you know about the cardiac cath and the nursing interventions for it. The medication, Coumadin. Make sure you know this medication. Make sure you know the labs you're going to be checking. Make sure you know what tests you're going to be performing. Make sure you know the safety measures in regards to that medication. Incident report. What is your responsibility as a nurse when it comes to incident reports? Where should the incident report be placed? Consent. When it comes to consent for invasive procedures, as a nurse, what's your responsibility? What do you absolutely not do when it comes to consent? Okay. Spinal fusion. Post-op, your patient just had a spinal fusion. What would be your nursing interventions for this patient? What would you teach this patient to do and also to avoid doing? Meningitis. Make sure you know that disease. Make sure you know what type of isolation the patient's going to be in. Make sure you know your nursing interventions for this patient and in what order. So placing them in isolation, you know, getting cultures, giving antibiotics. Make sure you can put it in order what you're going to do for that patient. What's the patient teaching? What are the signs and symptoms? What are those signs? For example, Brudzinski sign, make sure you know that. Fetal heart tone. You know, make sure that if you get a description and then you have an illustration of the pregnant woman, and they ask you where would you expect to get the fetal heart tone based on the description, that you know where to move that mouse. So make sure you know about the fetal heart tones and fetal positioning. Bipolar manic. So the patient that's in the manic stage of bipolar. What are those signs and symptoms? And more importantly, what are those nursing interventions? What are you going to do for that patient to keep them safe? CVP. What is the normal range for CVP? Patient positioning. Let's say you have a patient that's getting a paracentesis, right? That's that draining of like acidic fluid, right? How are you going to position that patient? Digoxin. What is the normal therapeutic range for digoxin? What are the signs and symptoms of dig toxicity? What are some things that you're going to watch out for that can cause dig toxicity, such as hypokalemia, some SSRIs? Stroke. What are the signs and symptoms of a stroke? What would be your nursing interventions in regards to a stroke? When you're going to feed the patient, depending on the type of stroke the patient had, where are you going to place their food? When you're speaking to them, which ear are you going to speak into? What are your nursing interventions going to be for that type of patient? Oh, I saw fetal heart tone twice. Okay. PPE. Different types of PPE for different diagnoses such as HIV, tuberculosis, dumping syndrome. What's going to be your patient teaching such as dumping syndrome? For example, are you going to tell them to drink with food or not drink with food? Are you going to tell them to lie down immediately after eating or don't lie down immediately after eating? What types of foods are you going to tell them to avoid? Make sure you know dumping syndrome. EEG. Make sure you know that diagnostic test and what types of diagnoses you would expect that type of test to be ordered. So, for example, patient with seizure disorder, okay? Chickenpox. Make sure you know when it comes to varicella, when the child is allowed to go back to school, when they would not be considered contagious. Also, make sure you can recognize what that rash looks like. So if you're given 4 different types of rashes, you can be able to visually identify that maculopapular rash. You can take the mouse and click on which one's that maculopapular rash for chickenpox. Oh, there goes CVP again. CVP. What does it measure? What does it monitor? What does the CVP tell you? Duration, frequency, and intensity of contraction. So that's a labor and delivery question when it comes to maternity. You make sure you know the difference between the frequency, the duration, and the intensity of contractions. Make sure you know referred pain. What are the types of referred pain? Make sure you know food items that are high in cholesterol. Lots of people every day, guys, are dying from heart disease. Cholesterol is a biggie. Lots of people will be admitted into the hospital with heart disease, right? So it's very important that you know the teachings and you know the foods that are high in cholesterol that you have to teach the patient to avoid. Lithium. This is an antipsychotic medication. Make sure you know lithium. Make sure you know the therapeutic range for lithium. Make sure you know the signs and symptoms of lithium toxicity. Make sure you know what fluid and electrolytes you're going to watch out so the patient doesn't go into lithium toxicity. Make sure you know signs and symptoms of dehydration and the complications of dehydration. Tube feedings. What are complications of tube feedings that would, I'm trying not to say, what are the complications of tube feedings that you'd be watching out for? It would be a priority for you to assess the patient for this, right? So we know with tube feedings, it's very sugary, so we're going to be concerned about hyperglycemia. We're going to make sure we're checking their blood sugar, can cause diarrhea. So we're going to be watching out for that because fluid electrolytes, that's important. We don't want the patient to lose that, right? That can mess with their physiological integrity. So make sure you know tube feedings. Bipolar again, nursing interventions. Here's a PEDS one. Make sure you know PKU. Make sure you understand the pathology of PKU. And if you had to teach to the parents what PKU was and the types of foods that the patient would have to avoid, that you know that. Signs and symptoms of Cushing's and nursing interventions. And last on this list I have is going to be priority assessments for the patient with myasthenia gravis. Your patient has myasthenia gravis. What are going to be your priority assessments? What are you going to be watching out for? What are you going to be the important nursing interventions for that patient with myasthenia gravis? And I think I'm going to make this a 3-part series. So this is part 1 out of 3. Part 2 coming soon. So that's it for this video, guys. Like I said, this was a very short video, but I know lots of you guys, you're studying and there's so much to study. And there is, I get it. But I'm asking you, please, everything I talk to you about, include it in your content that you're studying for the next generation NCLEX. Make sure that is part of your studying regime. Make sure that you understand everything that I mentioned to you before you go sit for the NGN. And that's it, guys. Please, in the comment section, let me know what you thought about this video. Let me know what you'd like to see me cover next. And in what format would you like me to cover the information in a lecture format, such as when I teach out of the book, or in a Kahoot format, or in a question answer format, such as the videos that are released every Sunday, 1 p.m. at Eastern Standard Time. I know somebody's going to ask, so I'm telling you now, don't even ask in the comment section, this information that I just went over with you, can I do it in a Q&A? No, I can't, and no, I will not, okay? I gave you the list of things that I encourage you to include in your studying plan. Now, it's up to you to follow through on that. So guys, I hope this video was helpful to you. And if it was not, I'm so sorry. Just don't listen to anything I have to say. I'm crazy. If it was helpful for you, listen to what I have to say to you, study it, and make sure you understand this stuff. Guys, thank you so much for watching this video. You guys can catch me on the next video.